Welcome to NeedyMeds. This is a patient assistance program like no other I've ever seen. Our guest is Dr. Rich Sagal. Dr. Sagal is the co-founder of NeedyMeds. And let's talk about some of the other resources that you have collected and made available to people who really need some help.
Well, to reach our goal of being the best resource for programs that help people who can't afford medications and healthcare costs, we found a number of other types of resources that many other sites don't list. For example, we list all the special government programs that we can find. The states may offer these programs for specific diseases, not just state Medicaid, for example, but the specific programs. And we have a few hundred of those.
Specific diseases?
Yes, specific diseases. We also have a number of camps, retreats, and scholarships based upon diagnosis. We have about 1,300 camps that they're for children who have certain diseases or come from families where maybe a parent has a disease, so they can spend time with other kids who are familiar with what they're going through.
Can you give us an example?
There are lots of camps for children with asthma, for example, or HIV, or cancer, hard of hearing or deaf, etc. So there's a wide variety of those, and as I said, we have about 1,300 of those right now. We have a few hundred scholarships, mostly college scholarships, that are specifically for people who have various diagnoses.
Are those for the patients themselves or their children?
Those are usually for the children, for the people who are actually getting the education. We have many other types of programs. We have a listing of application assistance programs. These are programs that help people apply to programs. For those that have trouble, don't use a computer, may have literacy or language issues. There are many, many of these programs, probably about 800 of those we have right now.
And so that would help somebody who needs assistance, who can't fill out forms. Maybe they have a disease, maybe they don't, as you said, they don't read or write. And so somebody sits with them in one way or another and helps to fill out those forms.
Exactly, and so this way someone could find a program to refer them to. And then we have a listing of over 1,000 different medication and drug and medical supply discount coupons. Some are for small amounts, maybe $1 or $2. Others are for $100 or more. So with certain ones that I recall, you can save $100 a month for 18 prescriptions. That's a lot of money.
That absolutely is.
So we are always adding to the database. We're always updating all of these databases. And with all of our information, it's totally free and access is anonymous.
MRIs and CAT scans are becoming more and more common, used as a tool for diagnosis. You also have discounts on those.
Right. We have partnered with an organization that provides discounts at many, many different facilities that do MRIs and CTs. It's not every facility, not every city or state, but many, many. So we encourage people who need a study like that, who have no insurance, to look on our website, find that information. It's easy to find, and give them a call and let them know you're calling from NeedyMeds, because we've seen savings considerable. They say 50 to 75% savings.
What is an average cost of an MRI today?
Oh, it varies quite a bit depending upon the MRI, but we could be talking a couple of $1,000s easily.
Wow, and having a 75% discount
significant.
Is significant.
Very significant.
Dr. Sagal, thanks for joining us. I'm Mark Allen, and you've been watching NeedyMeds. If you need healthcare assistance, we encourage you to visit us on the web or give us a call on our helpline. Those are both listed right here. You can go to needymeds.org or give us a call, as I said, on the helpline. We'll be back soon with another edition of NeedyMeds. Bye-bye for now.